World Hearing Day 2021 is tagged Hearing Care for All. It is a day that marks the launch of the World Report on Hearing, presenting a global call for action to address hearing loss and ear diseases across the life course. Well, joining us now is Dr. Sulaiman Abdulmajid, consultant, ENT consultant, to enlighten us more on the World Hearing Day. Glad to have you join us. What is the theme for this year is hearing care for all, if I get it correctly. What informed this theme?
Yeah. Good afternoon, everybody, to the RISE crew. The World Hearing Day, is a global event that also the largest awareness campaign for hearing loss and other issues around it. And the campaign usually occurs every third of everywhere, in which awareness is raised against on prevention of deafness, and also to let people know how to address it. So, and this year, the theme for this year is mainly caring for all, which also indicates screen, rehabilitate, and communicate. And this year, the World Health Organization also launched the World Hearing Report, in which they make guidelines, which, if implemented around the world, is going to make a lot of difference on prevention and treatment of deafness.
So it's a very important day indeed, but in a time of the pandemic that we are, everyone wearing a mask, well, not everyone is wearing a mask, but most people are wearing masks. How difficult is it for those with hearing impairment and diseases, especially because, we cover up the expressions behind those masks? Yeah,
it's very difficult. In fact, a lot of stakeholders are also looking at that. And because somebody that is hearing impaired, that's why we are advocating for an attention to deafness, because it's one of the areas that is most neglected in areas of non-communicable diseases, and unlike blindness, that everybody pay attention, that has sympathy. So for people that has hearing loss, many of them have to lip read, because especially when they have not addressed it, or they don't have the means to address it. So they have to be looking at the lip while they are trying to imagine what you are saying. So with the COVID pandemic, they cannot have access to look at the lip. So we realize that there are a lot of suffering for people that have hearing loss in order to be able to communicate. And even to get information is really extreme. So what some of the stakeholders are doing, like during this World Hearing, there are some launching of some different type of masks that is transparent, that you'll be able to look at the lips in order to help them to address it. I have not seen one in Nigeria, this type of mask.
I was privileged to witness the first Miss Deaf beauty pageant in Nigeria. And a lot of the stories that came from that was that a lot of the girls were born deaf. But I like the theme of this particular one is to do with preventative care. So what does the WHO stand to gain in terms of preventative care and inclusive care, and as concerns Nigeria?
Yeah, the WHO, the main advocacy for this year, apart from the awareness in terms of prevention, like about more than 80% of causes of deafness are actually preventable. While you have the other parts that are also cheap. And the fact is that there's nobody that has deafness that can also not be given hearing. That's is also a fact. But in the area of prevention, we have to get what are the things that can cause deafness in terms of a child that is born deaf, like the one you just said. A child that's born deaf can get deaf from family history, like if you are doing genetic counseling. Some people, they have deafness in the family, but still they still marry each other like consanguinity, and you see that they keep on increasing the number of people with deafness. Other things are good antenatal care that we have been advocating, also delivery in the hospital in order to prevent prolonged labor, and complication of delivery that could cause deafness. One of very important also aspect is immunization that we are talking about, to measles, to mumps, and all these things that are incorporated into the preventive health. These are the things that we are really doing a lot of awareness on. But not only on those types regarding to the public, but we are now really working on the policymakers in order to let the policymakers to be able to see the need for an increase, the fact that there is an increase in number of people living with deafness and unaddressed deafness, which is actually not unacceptable, so that we want them to be able to see the need and also be able to invest on early intervention or cost-effective intervention for these things. And these are the things that we are also trying to see. And cost-effective intervention will also increase the economic state of the society. And those are the key that the World Report on Hearing is trying to address. The other thing that is there is that in Nigeria, we are already working on that, and the federal government already had a strategic plan and policy which is yet to be implemented. And this will go a long way in addressing both prevention and treatment of deafness in Nigeria.
All right. I hear you talk so much about deafness, but I read the article. It's talking about deafness and hearing loss. What is the difference between deafness and hearing loss? And then how do you prevent hearing loss? And what are the causes of hearing loss?
Okay, yeah, thank you. Actually, I've mentioned that the hearing impairment or hearing loss, we know that deafness is not the same thing as hearing loss, because there are different grades of hearing loss, and at different grades, one can actually be getting disabled depending on the level of loss. Like if we can have a mild level of loss in which the person cannot get to hear whisper, like a chief executive like this, that you are whispering to the person cannot be able to, you will not be able to hear in order to understand what you are saying. Those are mild level of hearing loss. There are some that are level of conversation, just like we are conversing now. There are some people that will not be able to do that. Not that they are deaf, but the hearing has to be augmented for them to be able to meet the conversation. Those are the level of moderate to severe loss. And we can now have a profound loss, which is we call deaf or deaf mutism, in which when a child is born deaf, or they call it deaf and dumb. So generally the world is not going towards calling it deaf and dumb, but we call them that they are hearing impaired. So we leave them at that level, and that is when you have to differentiate between them like that. In terms of the causes of this thing, I've mentioned one can be born with it, or family history of deafness and of hearing loss, in which the person inherited. And that one is there, or the person acquired childhood deafness from childbirth, from neonatal sepsis, from jaundice that the child has, or the child is prematurely born and has low birth weight. And all these things have to be identified, and to be able to identify early, like when the child is born and the child had this type of history, that's why we advocate for checking or data screening of the child, so that you'll be able to identify this thing early, because the child that is not hearing will not be able to acquire speech, communicate, or develop language, or even be able to go to a mainstream school. So those are the things that then the other thing is immunization that we have always been emphasizing for children. It is very key to hearing loss and the development of hearing loss. So patients that are not immunized against measles, mumps, and all this polio and all this type of immunization, both the mothers at antenatal care and the children, can also lead to development. Other things are drugs. Many Nigerians go to over the counter and buy drugs. Some of them use drugs that will damage the cochlea and give them some level of hearing loss or a complete hearing loss. And those ones have to be identified. And the other thing that is important, especially among school-age children, is loudness, exposure to loud music, and loud sounds, which can cause damage to the ear. I've seen a lot of people that have damage to the hearing loss from noise. And these are also things that we have to emphasize to the people in the military and other people that have their work related to loud.
And we do really appreciate your time, Dr. Sulaiman Abdulmajid, ENT consultant on World Hearing Day. Much appreciated.